enthusiasm. In this age, you wanted to continue. Really, I appreciate you all. Yeah, markers actually. Markers. ठीक है हो गया क्या रिकॉर्डिंग हो गई रिकॉर्डिंग हो रही మరి ಇಬ್ಬರು ಬಂದಿದ್ದಾರೆ ಅವ್ರಿಗೆ ಏನು ನಾನು ಕೆಳಗಡೆ ಕೂತ್ಕೊಂಡಿದ್ದಂದ್ರೆ ಅವ್ರಿಗೆ ಸೆಂಟರ್ ಮತ್ತು ಇಲ್ಲಿ ಕೂತ್ಕೊಂಡ್ಬೇಕಂದ್ರೆ ಇಲ್ಲಿ ಕೂತ್ಕೊಂಡು ಇನ್ನೊಂದು ಕೆಳಗಡೆ ಕೂತ್ಕೊಂಡ್ರೆ ಸೊ ಬಿಸ್ಮಿಲ್ಲಾ ರಹಮಾನ್ ರಹೀಮ್ very happy morning to you all. Ellarku namaskara. Namaskaram to all of you, and it's the time to start the Sunday program, what we call as a vesical meridian. Hopefully every week we take something different concept and different meridian or the organ or the different level of teaching. But this week we have started vesical meridian. Vesical is indicating for the bladder, right? Whereas in numerous names for this meridian, one to be known as a Tai Yang meridian. Tai Yang is indicating this. Tai Yang is the supreme Yang. In fact, 72 total meridians. Among them, we can bring all those meridians to the compression way in order to understand only the 6 meridians. Among them 6 meridians, that's called as a Tai Yang, is the paid meridian. Which is the other meridian called as a Tai Yang? Please come on, guys, in the Zoom. Which meridian is the Tai Yang meridian? In fact, although we completed the same. Which is the Tai Yang meridian?
Small intestine.
Yes. So this should come very spontaneous answer because the pairing is so important. So when you wanted to understand the Tai Yang, it's coming to your mind. Either you treat to the urinary bladder is the vesical meridian, or you can treat to the tenointestinal, that's called as a small intestine meridian. So therefore both are belongs to the same nature. You look at about the correspondence of the image system of the body. This is called as a Tai Yang meridian, that is the pinky finger meridian. Whereas in same the Tai Yang meridian related to the pinky toe meridian, right? That's connecting to the Tai Yang, and Tai Yang is the finger to toes. The maximum optimistic meridian to be known as a vesical meridian, which having how many number of the points? Come on, 67 points are existing, which is the highest and longest meridian. So in that head to toe, in fact, you can see from the bottom to the top or the vice versa. From head to toe, it covers the entire spectrum of the diseases, that to be known as a vesical meridian. No doubt the vesicle is the part of the reproductive system. However, but according to the clinical conditions of aspects of the TCM, it considers that definitely this will be helpful to treat for the numerous and broad spectrum diseases or disorders. Hopefully, among the 67 points, I'll teach you each and every point how so crucial. That's the reason we do have till 2 o'clock. Perhaps it may go to till 2:30. I'm not very sure, but however, make sure that all the 67 points you register in your mind in the super simple way, mnemonics, how you need to keep it in the mind, all the locations, but I'll give you the subtle ways or the short ways in order to keep it in the mind, so that that will be easy to applicable in your clinical practice as well. Before going to stepping into that, let me start very small information related to the urinary bladder is related to the vesicle orb, ORB indicating to the organ, vesicle is indicating to the UB. However, the vesical arteries or the vesical vessels also supporting to the lower portion of the body, that's called as a UB. So UB meridian is the part of the kidney system. You all know that the kidneys started filtering of the blood, so and also water metabolism to be taken place with the support of the renal system. Then just this is the container. What is a container? Intestine also one kind of the container. In the similarly, the urinary bladder also, there is a container in order to store the water. What kind of the water? It is also urine therapy. I think Prime Minister of India, ex-Prime Minister of India, so he done the research on the therapy called as a urine therapy. So even urine also one kind of the therapy. The people who have the sickness, they can take certain things because that having the lot of electrolytes as well. Even electrolytes deficiency also reason to cause the numerous diseases as well. But however, that's the reason cow urine also, even in India, they are doing the exploration to do some kind of the research that will be applicable for the human practice to do some kind of the disease eradication. But however, it is still lot of exploration is required. But urinary bladder is just a storage organ after coming through the kidneys, and then it goes through the ureters. It's coming to the urinary bladder. That is the main physiological aspect. It stores the urine. So what amount of the urine will going to stored in the urinary bladder? When you urge to pause the urination, some people you have the experience. Yes, I have to go to the urination. Very oftenly, the people say, some people, once I leave the home, I'll come back to home, then only I go to my own washroom to pass my urination. I don't pass anywhere else. There are the two people category of the people as well, isn't it? So there is the capacity of the urinary bladder. So therefore, you remember when 700 to 800 ml of the capacity of the urinary bladder. When the urinary bladder having the holding capacity, when the uterine muscles are good, then definitely you can protect your urination till 3 hours, 4 hours, 5 hours, 6 hours, so on. But however, in the 3 hours period, it gives a signal to you that yes, you need to pause the urination. But whenever it takes some more time, maybe 300 ml got filled, then again you are giving the opportunity to yes. So further, because you are unable to pause the urine on that situation, maybe that sustainability to be taken place for another 1 hour. Then after pausing the urine, the total 400 ml, whatever it is stored in that need to be eliminated appropriately. If that not eliminated, because after the post 50 years of the age, some people will develop for the male and then female, that's called as the post void urination, that's called as after passing the urine, that will going to retention for around 50 to 100 ml into that. So what could be the reason? Because uterine muscles are deficiency or the overuse of the sexual activity, the prostate gland will going to develop sometimes that, and also some women will going to develop this kind of the problem that's causing, because I told you the people goes from the outside the house, then once they'll come back after 6 hours, 10 hours, 12 hours later, they'll pause the urination. So what does it happen? That will going to dilate, because the stomach get the contraction. Similarly, urinary bladder get filled, that get dilated. Once you get dilation all the time, then it will become the contraction of the more muscles, that will come the flaccidity sometimes. Due to that reason, the urine unable to pass the entire urination, that's called as a post void urination. 75 ml is retention is there in the urinary bladder. That's the reason people oftenly go for the urination, because 200 300 ml filled, but already it is there 75 ml. Again, there is a sensation to pause the urination, because we should not hold the urination as well. Look at about the areas, the ureters and urethral opening, trigona of the bladder, and mucosa, neck and urethra. So what exactly, this is the anatomical aspect. But inside, ureters are bringing the urine to the bladder, then that will going to store. There are the urinary bladder having the, how many openings? 3 openings are there. Trigone, that's called as a ureters 2 opening, then another opening called as a urethra. So therefore, in the 3 openings, it receives and then it eliminated it passes the urination with the support of the urethra. So now sometimes it get the gallbladder stone, that is the urinary bladder stone also will going to get the retention in the ureter. ureter and also junction of the ureter and then urinary bladder will get obstruction, or maybe there is a obstruction in the urinary bladder and urethra. This also kind of the obstruction, the neck going to close or partially will going to destroy that particular area, that causes the dysuria, difficulty of the passing the urine. But however, the urethra is the major role where the urinary bladder is existing behind the large intestine, where the rectum is there. Behind the rectum, the urinary bladder is existing. But however, urethra is the passage. But even male urethra is the different from the female urethra. The male urethra is the longest urethra, 9 centimeter, whereas in the female urethra is the 4 centimeter. Due to that reason, prone to get the women get more infection than the male. Eliminates the water and water passages, and it regulates the negative emotions. So what exactly there are the certain physiological concept of the urinary bladder according to the traditional Chinese medicine, but it consider that it's the water and water passages to be regulated. Water passages, again, two types. One to be known as a what we ingest or what we drink the water, that is number one. Number two to be known as a perspiration, sweating, that also one kind of the water, that also because it takes care by the two organs, one to be known as a pulmonary system, the second to be known as a renal system, is important to take care of the water passages. The water passages is indicating the skin pores opens and then closes timely, that to be taken care by this. It regulates the negative emotions. So the people today, I think the male or female or the children or the adult or the geriatric people, they do have some kind of the feelings or sensations, that to be known as emotions. Emotions easily impacted. You remember the people who have the fear or frightening or furious sometimes, all are connected to the urinary bladder or the kidney system. So therefore, whenever the feeling of the anxiety, even anxiety is nothing but kind of the fear. The depression is nothing but is the deep thinking. So which leads to this kind of the urinary bladder having the deficiency. That's the reason I think you can look at about the examination time for the children. At the time of examination, they rush to the washroom. First, I need to finish. Just he finished and came, but again he have the temptation to go for the washroom. There is inner small fear is there. Due to that fear, the people are excited to go for the urination, indicating the fear complex to be taken care by the urinary bladder as well. So therefore, anything is connected to the fear or frightening is there, or hesitation, all are connected to this sometimes urinary bladder as well. There is a suspicious about everything and everyone is the jealousy. So what is suspicious? Kind of the unnecessary thinking or jealousy with the other people, or sometimes the suspicious something about the doubtfulness. So I have something, my husband is where, my wife is where, my friend, girlfriend is talking to somebody, some kind of the suspicious mind we do have. So that also related to the two meridian, one to be known as a stomach, the second to be known as a urinary bladder as well. The holding the grudges from the too long period as well. The people see always this is a very important crucial role to everyone, especially to me, to you all, for the whole world. So people keeping something is inside the heart, inside the mindfulness. So indicating that maybe it happens sometime, so that always keeps inside our mind, so that we are executing timely. That's really not good. See, nobody is perfect in the world, but however, good deeds, please remember, the bad deeds don't. If the person done as 100 good things and one bad deed has done, then please ignore that, forgive that. If the forgiveness is the biggest medicine in the world, I wanted to say you, but if the forgiveness is there, your mind is good, your stomach and gut will be good, but then what else is required? Your health is good, then definitely that is the wealthy person, that is the healthiest person. In that way, some people will keep it like a long-term grudges, unnecessary. Simply, I'm not talking to my brother, I'm not talking to my sister. I think since 18 years, one man came with me and then he told I did not speak to the 18 years to my sister. What is foolish things is going on? So this is not really good for the simple things. The whole life done lot of things to them, each other. Then for the simple thing, you are keeping that all those things. That is, even God will not be good feeling. Remember, God says, whenever you forgive to the people, don't disclose the bad things to the somebody, then God will forgive you indirectly. That is the happiness. So because we have to hide many things, which is unwanted to create the things. Definitely that, because homely, good situation is required, happiness is required, pleasantable feeling is required. But if you don't keep it that pleasantable, that is the miserable in the life. We create to somebody, then God will create to somebody that creating the problem. That's the reason happiness is more important. The people done the good deeds, please don't forget. If you, even my teacher who taught me ABCD, who taught me about the acupuncture, one single point, then I need to give the gratitude to him. That's the reason God will give the happiness to us. If we forgive him, then definitely that will not give the sustainability and almighty, that throughout all the unnecessary things or maybe good things from us, so that will goes away. The almighty should give the healing hands to you. Please respect to the seniors, respect to the masters, respect to the parents, respect to our from all the teachers. But however, I grudges whatever you keep it, that please don't keep it. The almighty also will not be good keeping those things. It governs the reproductive system as well. What is reproductive system? Of course, the all the para are of the uterus, urinary bladder. We don't have any ovaries meridian. We don't have any fallopian tube meridian. We don't have the cervix meridian. We don't have the what we call as the uterus meridian, or we don't have the vaginal meridian or the orifice. But we do have the urinary bladder, which governs everything. So para-orb of the uterus to be known as a reproductive system. It governs the total take care of the reproductive system with the support of the kidney system. So this majorly we have seen related to the urinary bladder physiological aspect. But however, the urinary bladder also regulating to the bone system as well. Any bone stamina related disorders. That's the reason the kidneys govern to the bones. Kidneys governs to the bones. So hopefully, let me see about the various. Urinary bladder is a skeletal system. The majorly there is a bone related disorder, then think about the renal system, the kidney, and then urinary bladder. If the patient is coming to you, I do have the pain on my shoulder joint or shoulder bone, I have the pain, then don't directly say your kidneys are weak. So that causes again will be the miserable. However, the sense organ to be known as the ear. Auricular related disorders. Remember, any ear related problem, mild to moderate level, or the chronic condition, indirectly the renal system is affected. So therefore, any ear problem patient is coming for the ear pain, then don't say that your kidneys are weak. But however, the word you are using is not correct. However, you can recognize the kidney cheese deficiency, or the kidney cheese excessiveness, or the kidney blood is deficiency, kidney blood is excessiveness could be the reason to cause some kind of the auricular related disorder. The color to be known as a blue color, it is indicating to the urinary bladder. Sometimes it considered as a black color as well. When you wanted to cool down the kidney system, even some kind of the chromotherapy, that you just use the black color, that also will be slightly helpful. Deficiency, incontinence of the urination due to the coughing and sneezing and low back pain. So the people says, when I cough, it gets the urination, because you remember what I told you, at long term holding the urination, which is not good. Due to that reason, the uterine muscles are weak. Then once you cough or sneeze, then urine it comes out. But that also related to the deficiency of the urinary bladder is the reason to cause the incontinence of urination, and also sometimes the low back pain. Then further, the urinary bladder excess is indicating there is a pain and then burning urination, fever and chills and loss of bladder control. So when the excess condition is there, obviously anything is excess, there is a burning sensation. The pathway is the primary pathway, divergent pathway, sinus pathway, collateral pathway, interior pathway. All are related to the urinary bladder we're going to learn. So young, what is the organ clock timings of the urinary bladder?
3 to 5 p.m.
3 to 5 p.m. What is the opposite time? 3 to 5 a.m. Lungs. That's great. If, remember, is the key point. Whenever the urinary bladder having the problem, then indirectly the lungs also affected. When the lungs having the problem, cross check. Do you have the urinary bladder related disorders? Do you have the leukorrhea? Do you have the back pain? So you just correlate this. This is the secret. Whenever you do the pulse diagnosis, that time you recognize the UB is deficiency. Then urinary bladder means two things come to your mind. One to be known as it. This is the Taiyang. Then you remember the another Taiyang, small intestine. Do you have the GIT related disorder or the shoulder? Because the small intestine covers the shoulder and then scapula and the neck region. Do you have the neck pain? Cross check. If he says you do have the pain, don't treat to the urinary bladder, treat to the small intestine. At the same time, when the that is the UB having the deficiency, then Taiyang, then pairing to be known as a Taiyin, that is the opposite time. So that to be recognized as a lungs having the deficiency could be the reason to cause the problem of the urinary bladder as well. So hopefully this sequence is, you need to understand, that's really important, because you people going to learn infinity level, you're going to learn later period after 5 years, 10 years, 20 years, you recognize. But in the short and sweet way, all the clinical experience I'm sharing it to you, but definitely this will be added advantage in order to implement in your clinical practice. The polarity to be known as a yang, that belongs to water element. Obviously there is emotion to be known as a fear, or also fear is slowly fear. Maybe I go, my master or professor will ask you, so did you complete it, did you complete your notes, or please you just show me something. They ask you, they do have the fear, but at the same time frightened, suddenly get the frightening. So that frightening also, which leads to the several disease or disorders. Then the season to be known as a winter season, and also the number of the 0.67 I told you, the taste to be known as a salty taste. Salty taste, it goes to the sour taste goes to the liver, salty taste goes to the kidney, sweet taste goes to the spleen, and bitter taste goes to the heart, right? And similarly, the pungent or the spicy taste goes to the lungs. So similarly, each and every taste is connected here. Now let me see that there is a divergent meridian. So divergent meridian to be known as a, so where it starts in the pelvic region, it starts from the center of the body, then further it ascends to the upward direction and reaching to the back region and also lower portion. Then that's not so crucial, but however we'll see the sinus channel will start from the toes, that's called as a the pinky toe. From the pinky toe it goes to the ankle, from the ankle it goes to the knee, posterior side of the knee, from the knee it goes to the back region of the exactly on the glutes, from the glutes it goes to the neck region, and then from the neck it comes to the nose region, and also it inside it nose eyes goes, from the eyes it goes to the Qianqing, that is the GB21. Then further there is another ramification goes from the Ka Wangshu, that is called as a UB43. From UB43 it goes to the Qianqing, that is the GB21. Before that there is a branch goes from the midline of the back region, from there it goes to the axilla, that's called as a Chichuan, that is the heart one. So these are the primary principal meridian. How many number of the points we do have? 67 points are there. So these are the points where we will see here. So it starts from the inner canthus of the eye. Inner canthus of the eye it starts. It starts from the inner canthus of the eye. From there it ascends to the upward direction. That's called as on the lateral side of the midline of the head region, then comes to the back of the occipital region. From the occipital region, it comes down and then it's coming. This is the one branch that's called as a Tiansu. One branch got terminated. Remember, there are the 4 ramifications are there in the urinary bladder. One ramification from here to here. There is the one UB1 to UB10. There is the one branch is completed. Then another branch to be known as a UB11. From the UB11, it is coming downwards direction, and then it's coming to the popliteal fossa, that is the UB40 Weichung. The second meridian, that's called as a second branch or the collateral communicated, it's completed here. The third ramification starts from the Fufen Pohu from the UB41. From the UB41, it descends this called as a one line to be known as a medial meridian, the another meridian called as a lateral meridian. Medial meridian towards the spine, lateral meridian away from the spine. So this away from the spine is coming downwards direction, and then further it reaching to the Weichung, that is on the second ramification, then it's completed. The fourth ramification starts below the popliteal fossa, that's called as a Heiyang, that is UB55. From the UB55, the energy comes and then terminated on the pinky toe. Yes.
Prof,
Yes,
the
Larita.
camera is not showing well. It's blurring.
Yes, exactly. Even I do feel. No? Yes.
It's blurring.
Yes, exactly. Floaters are there, I believe.
Yes.
So,
yes.
however, you can have a look, Larita. Here also, it's very clear image is there. So, from here, where it starts from the eyes, and then it goes to the top of the head region, then comes and then terminated on the cervical region. One branch is completed. So 1 to 10 points we're going to see. In fact, I love all these points will be day-to-day clinical practice. Really, it's required. Then further from the entire back, there are the 2 lines are there. There are the 2 roads or the 2 highways are there. In through that highways, bullets are there. Those bullets to be known as a anti-acupuncture points. Then further from there, again it comes down to the urinary, that is the knee region. From the knee it descends to the downwards direction, and then finally terminated on the pinky toe. That to be known as a UB67. But I request you, please, all of you, please listen with your heart. So once, because every point is crucial, but I don't know how I need to cut short, because it takes me 2 days to complete the entire portion, but however I'll try to complete before stipulated time. So now one by one we're going to see. These are the Chinese and pin-in names. This is the Chinese and then pin-in names. Now I'll try to pronounce with the pin-in names according to the pronunciation of the Chinese medicine. Then you, if possible, try to recognize and keep it in the mind. That always is good. But you just listen this. How many points? 24 this is. After 24, 50 points. Then I'll try to change this slide. You just listen. So I'll just convey in terms of the different pronunciation. That also you keep it in the mind. That's really good. If you like it. Some people you don't like it, then you need not to worry about it. But however, let me start from the UB1. UB1 point is Ching Ming. Ching Ming. So 1 to be known as a, yes, 67 points. I'll tell you the opinion names. Please you just go through. 1 to be known as a Ching Ming. Ching Ming San So Mi Ching Chu Chai Wu Chu Cheng Kuang Tung Tian Lo Shu Lo Shu Yu Zen Tian Zu. How many points? One branch is completed. Ching Ming San So Mi Ching Chu Chai Wu Chu Cheng Kuang Tung Tian Lo Shu Yu Zen Tian Zu. 11th point. Ta shu, ta shu, feng men, fi shu, chu, in shu, sin shu, tu shu, ge shu, kan shu, tan shu, pi shu, wei shu, san jo shu, shen shu, chi hai shu, ta chang shu. Ta chang shu, xiao chang, kuan yuan shu, xiao chang shu, pang kuang shu. Then chung liu, shang liu. Chung liu, pai, pa wang liu. Pa Huang Shu. Then you come to the 31, Sheng Liu, Si Liu, Chung Liu, Xia Liu, Hui Yang. Then there is a Cheng Fu, Inem and Fu Si, Wei Yang, Wei Chum. Then 41 point. 41 point is, so Po Hu, that's called as a Fu Fen Po Hu, Fu Fen Po Hu, Ko Huang Shen Tang, Wei Si. Then Yang Ge Kuan Hunamen Waishi Ge Kuan Hunamen Waishi, that's called as a Yang Kang Waishi Wei Kyang. So Huang Men, then further UB51 to be known as a Huang Men Si Shi Pa Huang Si Pia, that is UB54. Then the fourth branch to be known as a He Yang Cheng Chen Cheng Shang Fi Yang Fu Yang Kunulun Pu Shen Mai Chinmen Chingo Shugo Sotongo Chayin. Totally how many points? 67 points. We're going to see step by step these points where exactly is now appropriately is located. Now let me start. The first point is UB1, that's called as a Ching Ming. Ching Ming is the one particular point where exactly is located. Point 1 shown proximal to the superior corner of the inner canthus of the eye. This point is located inside of the orbit, but not the outside of the orbit. But certain points that's called as a Chengchi, Cholio, that's called as a UB1, stomach 1, and then extra point which is located inside the orbit. There are the 3 points are located inside the orbit, but not outside the orbit. But no doubt the other points also located, many points outside the orbit as well. The first point to be known as a inner canthus of the eye, the point is located. Inner canthus of the eye, the point is located, but you just prick inside the eye orbit. But however, this is the vulnerable point, but this is the dangerous point. That's the reason it's not advisable. But however, I'll try to show you where exactly this point is located through the practical. But rather than that, I'll give the complementary point or the alternative point for that UB1, that point to be known as a San Su, that is the UB2 point. Where is the UB2 point is located? So UB2 point, medial end of the eyebrow. Medial end of the eyebrow, the point is located. You just apply downwards direction. That's communicating to the Qingming. That is the UB1 point. So UB2 point, this muscles called as a corrugator muscles. But in this muscles inside, you just apply. There is small foramina is there. In that foramina, you just apply and then bleed that point. That also really good to treat for the numerous eye-related disorders. Since the point is located on that particular region, therefore that point is really good. If the people will get some kind of the pustule or the carbuncles or some kind of the infection inside the inner canthus, then you remember 2 things. One to be known as the people says I have something here, there is some kind of the irritation inside. Then according to the iridology, according to the eye diagnosis, inner canthus is related to the very good heart. The second to be known as there is the inner canthus, is pustule is there, then you recognize the problem is if you can identify by asking them, do you have UB related disorder? Do you have any menstruation related issues? Do you have the leukorrhea or the white discharge? So something you cross check to the patient, then patient will going to tell you, yes, I do have the problem in the urinary bladder. Maybe you ask me, eventually completed all the 67 points, but I would like to give you only very few points. I'll give you that points we're going to treat from the all the 67 points. That I'll keep it now as a hidden secret. Most probably once completed all the 67 points, please let me know, that I'll try to give you that answer to you all. Then that to be known as a location on the face, where exactly on the sanso. Remember the people who are suffering for the various types of the facial paralysis, or maybe some deviation of the glabella is not going upward direction. Indirectly will going to help. That takes a lot of time, however, but indirectly will be helpful to treat for this. The facial paralysis or the glabella pain or the frontal sinusitis, or there is sphenoid sinusitis or ethmoid sinusitis or maxillary sinusitis. This will going to help them in order to drain out which is accumulated or got the retention. Even doing the moxibustion is prohibited, but mild moxibustion to be given in this particular region. The people have some kind of the blurry vision or some kind of the redness in the inside the eye system. So that time the fire is excessiveness in the urinary bladder, or the fire is connected to the liver and gallbladder as well. Liver or the portal, liver is the portal of the eyes. Anything eye related problem, then you remember there is a hepatic related problem, then the eye vision problem, then immediately don't say you have the liver failure or the liver having the problem due to that reason. Please don't execute like that. But how you can say there is, according to the TCM, the chi is deficiency or the shui means the blood deficiency to the eye system could be the reason, or maybe the liver fire flares up. That's the reason there is a redness in the eye system. The people reason you just check, maybe he could not sleep properly in the night time, also could be the reason. So in the similarly you just add up these points will be helpful to treat for the what condition. Which point is it? Yeah, UB2. UB2, hopefully we completed this. I'll try to show you how to bleed. Make sure that lancet is available here. The third point to be known as a Michung. Chingaminga Sanso Michung. So Michung, the point is on this scalp, just directly above the UB2 point. So the point is located here. So this point also will be helpful to treat for what condition? UB? UB2, UB3 point for good. It's good for the nasal congestion as well. So therefore, this also applicable to treat for what condition? So two things. One to be known as a frontal related disorders, and along with that is the nasal related disorders. Even for the both the conditions can be treatable by activating this particular point. How to recognize this? UB2. Hopefully you complete this UB1, UB2 vertically above the UB2. So exactly the point is half shown above the hairline. The point is located. I think whether you just check whether I'm just applying on the right point. So this you just apply the downwards direction. You just apply downwards direction to treat for the nasal related disorders. That always is good. Then the further fourth point to be known as a fourth point is Chu Chai. That's called as a 0.5 chun within the hairline. Now the points are 1.5 chun lateral. Remember, this is the key. Now I am giving you that entire region, the points which is located. What is from where to where? This is the midline. This midline to be known as the sagittal line. This is the coronal suture and this is the lambdoid suture. But here there is the line that's called as a mang nikalte, the people who does open this entire region. That central line to be known as the sagittal suture. So that sagittal suture, from there 1.5 chun, that means the 2-finger breadth lateral. Lateral means away from the midline. 1.5 chun lateral to this region. That 0.5 chun. This is anterior hairline. Is it this anterior hairline? No. Anterior hairline where the hair starts. That region to be known as the anterior hairline. From there you just measure 0.5 chun above. This is the Chu Chai point is located. So this point also helpful to treat for the frontal related disorder. Remember UB3 point, another specialization to treat for the one particular condition. You remember this moment I'm getting that Emomoto new scalp acupuncture YNSA method. So that it gives the 3 brain points. One to be known as the cerebrum, basal ganglia, and then cerebellum. Where the points are located, 3 points are located. Central point to be known as a basal ganglia, right side point to be known as a cerebrum, the third point to be known as a cerebellum. So there are the 3 brain areas are there, but half to 1 inch needle you just apply perpendicularly or maybe horizontal cutaneous way, and that will be helpful overall for the brain related disorders. It will going to help you. It's not that we're going to treat for the entire central nervous system, that will going to support you. Then there is the one point to be known as a 1 chun posterior from the anterior hairline and 1.5 chun lateral to the midline. That point to be known as a Wu Chu. Wu Chu. So this is the headache and dizziness, hemiplegia, epilepsy conditions. We can use this point. Since this point is useful for the epilepsy, we have mentioned there is a epilepsy is indicating frontal lobe seizures. frontal lobe epilepsy. There are the numerous places it gets some kind of the changes in the neurons. So that time we wanted to use the point that's called as a UB5 point, also good to treat for the frontal lobe epilepsy, not the other lobe epilepsy. Then further the UB6 point, this point also really important, 2.5 chun posterior to the anterior headline, 1.5 chun lateral to the midline, but this is called as a Wuchu and then Chenggang. So this point is really important to treat for the prefrontal cortex of the visual cortex of the brain. Visual cortex are the two types, one to be known as a posterior visual cortex, but the second to be known as the frontal lobe visual cortex. Even I wanted to remember the another point to be known as there is a Yangpai, this is the Yangpai, and then this is the Benshan, then further is the Chengguang, the point to be known as Zengling. You gallbladder 16 and then gallbladder 17. So gallbladder 16 and 17 and also UB6 and then UB7. That area to be known as a visual cortex of the brain on the frontal lobe. But this is slightly lesser important than the visual region, where exactly in the occipital region. Might be there are the numerous reasons to cause the problem of the vision. Greater than 80% people will suffer because of this. Even 20% approximately, there is a problem on this region, also reason to cause the vision related disorders. That's the reason we try to recognize the points are connected. When you wanted to focus to treat for the vision, then focus on the front side and also the posterior side of the brain. Both are really important. So then there is a Tung Tian, there is the UB7 point, where the point is located 4 chun above from the anterior hairline, then further 1.5 chun lateral to the midline. So 4 chun means 3 fingers plus 1 thumb. So 3 plus 1 thumb, 4 chun. 4 chun above from this line and then 1.5 chun lateral to the midline. The point is located, that's called as a Tung Tian. Remember, this point is good point to treat for the olfactory bulb. That's called as a nasal related disorders or the nose related disorders. But the people who get the anosmia, that means absence of the smell, even during the COVID time, they could not recognize the smell. Even that particular time, it's advisable to use the point. All the nose related, no doubt the olfactory bulb is located exactly on this region also, where the tears glands and also lacrimal glands, and also there is a olfactory bulb is located front side. But this indirectly will be helpful to treat for the nasal related disorder. No doubt you are using as a Intang, Bitung, Ingxiang, Nosilio. There are the local points are located in this region. But along with that, give one command from the brain. This is what I wanted to, the people says I wanted to practice as a TCM acupuncture. Along with that, we need to learn about the modern concept of the brain areas. The brain is divided into how many segments? 52 segments. That's called as the Broadman areas of the brain. So those areas also you need to recognize, yes, this is related to that function, this related to that function. Even whenever I'll tell you, please you try to explore at home, that try to recognize that Broadman areas. Whenever we wanted to do something, then you try to recognize. Whenever I'm going to teach you about the scalp acupuncture, hopefully another 2 months or 3 months later, I'll take up the scalp acupuncture. That time I would like to give you the Broadman areas. If you're unable to recognize this time, but definitely I'll try to teach you that later. I go for the scalp acupuncture points, but easy to recognize. So those concepts, how the mnemonics are, how to keep it in the mind easily, that also will going to address you. But however, UB7 treat for the what bulb? Olfactory bulb. Olfactory bulb is blocked. Then what happened? It will not give the signal to the nose. So that's the reason anosmia will going to happen. So we just use the UB7 point along with the local points. No doubt, Ingxiang, there is the point called as a large intestine 20. Welcome the fragrance. Local point we use, yes, welcome the fragrance, please come the fragrance, please come the good odor. So then you give the one command to the Tung Tian also, indirectly will be helpful along with at this point, and then this point together will be helpful. Then Lao Shu, that is the UB8 point. I love this point too much because the point is located 5.5 chun above from the anterior hairline, 1.5 chun lateral to the midline. Always you remember this is the way of coming the points. 1.5 chun lateral. From here the points get changes. That point to be known as a Lao Shu. That exactly where what is the physiology of this point? Treat for the pineal gland. Treat for the pineal gland. So where the pineal gland is located? In the center of the brain. Where in the center of the brain? The brain the thalamus, hypothalamus, subthalamus, epithalamus, 4 types of the thalamus. But in that where the midbrain is located, epithalamus, the point is located, that's called as a, even, do you know pi hui, DU20? DU20 is the 1.5 tune lateral to DU20 and 0.5 tune about to that region, that also tranquilizing point, sedative point. So therefore, the pineal gland is the major role to regulate the natural sleep, obviously. So natural sleep, how many people will sleep? Natural sleep, all of us here, I believe. So however, the people will sleep with the synthetic medication. The people will sleep with the nicotine. People will sleep with the medications. People sleep with the alcohol, isn't it? Naturally, they don't sleep, but they want something, stimulation to the pineal gland. The stimulate of the pineal gland, how much ml or how much gram and how many kgs will going to produce the pineal gland? Melatonin. Very good. 1 mg, just 1 mg will going to release the pineal gland of the melatonin. So how much is required? I think you look at about the pharmacy. Doctor is available here. Vasant, right? So he promote that medicine, Restil 0.25 mg, 0.5 mg, Zolpresh 5 mg, 10 mg. Yeah, melatonin, even today, USA started melatonin tablet. Even India also brought that melatonin tablet today. But yes, 3 mg and then 10 mg tablets. But this indirectly you are giving to the pineal gland. Baba, it is naturally existing in the brain. Almighty created the pineal gland to release the natural melatonin. When it will going to release? During the darkness. So the sunset is over. Please go return back to your home. But we do the against the nature, including me. Right? We work the after sunset. So therefore, when 10 o'clock or 8 o'clock over, then all the mammals, especially the birds, they goes to their home and they relaxes. 8 o'clock is the time to take the sleep. So that time it started releasing, even for the all the people across the world, and also the animals will going to release this. No doubt certain animals are the night animals, but no doubt in that for them it going to release in the daytime. For us it will going to release in the night times. So therefore, the pineal gland is so important to secrete the melatonin naturally. You just apply bilaterally because pineal gland is existing here. Then you just activate for the both that, because right hemisphere is different from the left hemisphere. We do have the two brains, half of the brain on the right side, half of the brain on the left side. You just target and then apply the low shoe bilaterally. Along with that, you wanted to add up the point to be known as a pi hui, that is the DU20. Once you take the needle and then this having the great calmness effect. So once you apply this, so that having the great tranquilizing effect and sedative effect in the body. So therefore it gives, whenever you are stressed, even that time also you wanted to apply when you wanted to sleep, because when you are stressed and overworked, then definitely it's the time to take the relaxation. Then you just apply the needle and then you wanted to relax yourself, definitely you can do that procedure. That also really good. The people who take, if continuously we activate this indirectly, you need to minimize certain medication, that's called as a, maybe anything is the antidepressant or maybe something is the sleep medication, that slowly you need to taper the medication, otherwise it causes the withdrawal symptoms as well. Then the point to be known as a UB9 point, that's called as a U Zen. So now the points from 1 to 8 completed. Now 9th point is coming from the different location. Where is it located? 1.3 chun lateral to the posterior midline and 2.5 chun above the posterior hairline. Now I was talking the anterior hairline. Now I'm talking about the posterior hairline on the back of the hairline. From the back of the hairline, 2.5 chun above. That means the 3 fingers, approximately more than 3 fingers. Then above 3 fingers from the posterior hairline. Then 1.3 chun lateral to the posterior midline. Here is 1.5, but no problem. Even you wanted to recognize 1.5 doesn't matter. But that's because one acupuncture point covers the how many mm? Yeah, 3 4 mm it covers depending on the location. So therefore that covers, you need not to worry. You just apply the point called as a UB10 point. UB9 point is the U Zen. That's really good point to treat for the brain. Even there are another point I'll tell you, that's called as a Tian Su. Where the Tian Su point is located? Tian Su point is 1.3 chun lateral to the posterior hairline, and then 0.5 chun above the posterior hairline. Where exactly UB10 point is located? So UB10 point is located here. The UB10 point is exactly is located here. That is 1.3 chun lateral. So therefore, when we apply this particular point, that is called as a U Zen and then Tianzu. UB9 and then UB10, both both the functions to be known as related to the, even Chinese people says that the blood of the overall, there are energies entering to the brain through this point. No doubt there is a Feng. Feng means the gallbladder 20 as well. This particular area that's called as it Yemen, Yemen, Fengfu, Nahai, then further Tianzu, Yuzen, Fengt, and then Wangu. These are the few points that are existing here. Those all the points will be helpful to treat for the brain related disorders. Right? Anything. That's the reason the ancient people, this is don't hit on the scalp region, don't hit on this region, don't hit on this region. What does it mean? Because the brain is located here, medulla oblongata is located here, cerebellum is located here, hind brain is located here, then that is the smallest brain is located here. Don't damage to that area. If you damage that, but obviously the chances are there that deeply connect to the brain, that causes there is kind of the paralysis, that causes sometimes the more than that, person will go to heaven. So therefore, we should be very careful when the UB9 and UB10 points are really great point, where the occipital artery and then lesser occipital artery, the greater occipital now also will going to support to that particular region to treat for the occipital related disorders. Yes, indirectly we're going to help. Yes, obviously, because that I'll tell you where the C1, C2, C3 is there, how the V1, V2, V3 is there, but that also indirectly will going to help. Then the point to be known as a Tian. Tian means is the heaven, Shu. Tianzu point is located UB10. Where the point is located? Just on the posterior hairline. You just see the posterior hairline. Then point is in the zoom. People who are sitting next to you, you ask them to sit to somebody if possible. Then you try to recognize this where the point is located. Then easy to recognize and understand. Then the point to be known as a 0.5 tune above the posterior hairline and then 1.3 tune lateral. That means you keep it as a one thumb. You keep it as a one thumb. Then 0.3 tune little away. Then you just apply that point. That will be helpful to treat for the medulla oblongata and also treat for the brain related disorders as well. So hopefully the problem, the people who get the problem of the cervical, or maybe there is a problem in the head region, that's called as a junction of the head and neck region. The head is completed. When head going to complete? Where it going to complete? The bone. Which bone you need to remember about the scalp? Atlas. Atlas bone is holding the entire scalp. Entire scalp nearly 2 kgs of the scalp. How much kgs of the brain? 1268 gram. Very good. So more or less is the same. So that much only the brain. Then what about the bone? What about the muscles? So entire things are holding the only one bone, that bone to be known as the atlas. Just below that, where the C1, C2, C3 starts, atlas. Above the atlas and below the axis, all our cervical bones are going to start from this region. Right. So now we will proceed for the UB10 point is completed. So this is really good. The people who are suffering for the cephalgia. Cephalgia is cephal. Cephal means is the brain and also pain. Then further cephalgia is the cervicogenic headache. Cervical pain also, headache also. In that condition, I don't have the pain in this region. The whoever people says I have the pain, but then you can recognize sometimes vision related disorder and also cervical pain and headache as well. So therefore, this is the crucial part where we need to address for the cervicogenic headache. And the people who are really suffering, ask them to give the pressure and then 2 to 3 minutes, you just give the pressure in this region. Then ask them to move the head like this. You feel lot of relaxation. People, we do a lot of mistakes as well for the day-to-day life, forward direction and sleeping, talking and watching. So those things, it causes the problem here. Due to that reason, we always erect the spine, then give the pressure on this region. That always is good. Then further, now one branch is completed. Now I'm coming to the next branch to be known as a Ta Shu, UB11. Please remember, now I'm giving you some inputs to you. Then how to recognize all the 67 points. But I'll tell you 20 points in your packet right away. 20 points in your packet. Need not to worry, but easily you can recognize. How many vertebrae are there? Good. Cervical vertebrae are 7. Then
12 thoracic. Thoracic
yes.
12.
Now this one,
5.
very good. Spinal nerves are existing close to that region. Spinal nerves are existing there. But each vertebra, there is a acupuncture point. There is each vertebra, there is a one point. In that way, we'll try to keep it in the mind where the points are located, what are the importance of that point as well. Now, let me start UB11. UB11 point to be known as a Ta Shu. Where the point is located? 1.5 tune lateral, 1.5 tune lateral to the lower border of the spinous process of the each vertebra. I think a spinal cord is there. Please district. Oh, good. Thank you. So this is the bone called as a, this is the atlas. Yes, axis is this. From here downwards direction, all it's coming like a C1, C2, C3, C4. After that is the thoracic bone. T1, T2, T3, T4, T5, T6, T7, right? So in this thoracic region, now you just recognize one. I'll give you the example that is applicable to all the points, right? 1.5 chone, that means two fingers from the center of the spine. This is the, which is the center of the spine, and this is the center of the spine, where exactly this is the center of the spine. 1.5 tune lateral from the center, 1.5 tune lateral to the lower border of the, lower border means below the border of the spinous process of the, this is the spinous process, each vertebra, spinous process of each vertebra. This is, you can look at about the two vertebrae. Just below this vertebra, the point is located. Where the below the vertebra, what is existing? Nerve also existing. What is this yellow color? Nerves. This yellow color nerves are existing just below the vertebra, each vertebra on the spinous process. Therefore, you are treating to the spinal nerve also. You are treating to that particular acupuncture point also. Therefore, all the points are located in this particular region. Hopefully, we will going to see one by one. So the shoe is indicating is the means is the great, the means is the big, shoe means is the point, the shoe point. But this point is located on the 1.5 tune lateral to the lower border of the lower border or the caudal border, superior language to be known as a caudal border of the spinous process of the each vertebra, that to be known as a UB11. But now UB11 point is located where is on T1. Remember thoracic one. UB11 is UB11. 11 means 1. 11 means 1 you recognize. Then which vertebra point is located? T1. 1, 11 plus 1, that's called as a T1. Thoracic one, T1, T2, T3. Or TV1, TV2, TV3, TV4 also people recognize, or the textbook author may write. TV1 is thoracic vertebra, or the T1 in the simple language, T1. When you do the MRI scan, that time they'll tell you D1, D2, D3. D1 means indicating for the dorsum region, dorsal vertebra. For that's the reason they mention as a D1, D2, D3. But however we recognize that the T1 will be better to recognize. Now UB11 point on which vertebra point is located? T1 vertebra. It is the above the thoracic vertebra or the below the spinous process. Below the spinous process, the point is located. That you just keep it in the mind forever. Right? If you are applying superior point, but that point is something different, but that's not the same. So now UB11, the importance and significant role to be known as a influential point. Influential is indicating a specific tissue. Specific is the cell-related disorders treatable by activating that point. Is indicating UB11 is good point to treat for the all the skeletal system bone-related disorder, and also rather than bone, here we can mention as a cartilage related disorders, bone and cartilage, or maybe the tendon and cartilage related disorders. UB11 point is good point to treat for the cartilage related disorders, or the muscle related disorders, or the tendon sinus related disorders, or maybe it is the cartilage and also there is a tendon for the ligaments related disorders also we can consider UB11 point, right? Then any problem the patient is complaining, I do have the kind of the arthralgia, I do have some kind of the bone pain, then please don't forget to apply this point. Will be helpful to treat for the skeletal system, especially there is a cartilage and then is the tendon related disorders. Then I'll show you all these points. I'll show you the practical. Hopefully we're going to see the UB12 points known as a Feng Men. Feng is indicating, Feng means is the wind, Men means is the gate. There is the wind gate is existing here. There are the totally 12 acupuncture points are there in the wind related points. But in among them, one point to be known as a Feng Men, that is the UB12 point. Now 1.5 tune lateral to the lower border of the spinous process of the which vertebra the point is located? T2. Remember is the T2. When I'm talking about 13 point, then it is the T3. When I'm talking about the vertebra. In this way you can recognize. Please go through book as well. You come to know. Then further, the point to be known as a UB12 point. Remember, this is specific point because each and every point having some kind of the specialization treating for that particular condition. Now, this point to be known as a back point to treat for the vertebral body related disorder or the bone related disorders. Vertebral body or the bone related disorders. And some people having the hunchback, they walk like this, so that indicating there is the two reasons, one to be known as a kyphosis, the second to be known as a ankylosing spondylosis. Here is the problem. Then due to that reason sacrum is affected, due to that reason it affected on this region. So therefore when the patient is walking like this, so that time you remember the problem is on the especially kyphosis. There is a kyphosis, scoliosis, lordosis. There are the three spine related problem majorly, but in that condition you just use the to making the alignment of the body. Then you remember the point to be known as men, that is a UB12, that's related to kyphosis related condition. But however, not only that, the people who have the alignment got changes, because always the spine is like this, it's slightly S shape, to be known as a spine. Slightly, it's not the totally spine is very erect, but it gets slightly changes, but it get changes too much. Yeah, it is like a curve is there like this, and the patient walk like this. The walk like this is indicating there is a spinal cord got the scoliosis. Even for that condition also you wanted to use the point, that point to be known as a which point? Men, that's also UB12 point. But along with that, the specialization, there is the cold related problem, two types of the cold. The one to be known as a common cold, or the second cold to be known as a chronic cold condition. Even for that condition, for the acute cold, for the last 2-3 days, I do have the running nose, I do have the cold and congestion. Even that indirectly will be helpful for the lungs as well. So then common cold can be treatable by activating to the UB12 point as well. That's called as a Fengman. By the way, anything is the wind related problem. Because of the wind, because monsoon getting changes, the environment, climate getting changes, that causes the problem. Even that condition, definitely you can use the point to be known as a UB12 point as well. Now coming to the third point to be known as a the UB13. UB13 point to be, where is it located? 1.3 tune lateral to the lower border of the spinous process of the third thoracic vertebra, third TV. So third thoracic vertebra, but this point also helpful to treat for what condition? Good. Chronic lungs related disorders. Now the lungs problem again, it is two types. One to be known as the acute problem, second to be known as a chronic lung condition. Even all the back shoe points are treatable for the chronic disorders. The move front alarm points are used to treat for the acute conditions. Acute conditions from the front side of the body, the chronic condition treatable on the back side of the body, because when the lungs chi is infused in the back of the area where exactly reaching to the pulmonary system. So therefore the back, it's indicating alarm point is indicating, the alarm is indicating when you give the pressure on that particular region. For example, UB13, you just give the pressure. If the lungs chi is deficiency, that time you just apply the pressure, patient feel, ouch, I do have the pain because my lungs having the deficiency. Perhaps lungs again is divided into two, right lung and left lung. Again, right lung is divided into 3 lobes, left lung is divided into 2 lobes. But however, any lobe having the problem, then you just give the pressure on the UB13 point. If the lungs deficiency is there, patient feel, I do have the pain, is indicating the chi is deficiency. When you touches, the patient feel, ouch, I do have the too much pain, then it is the excessiveness of the lungs energy could be the reason. When you touches, it causes the pain. When you go deep pressure, the patient gets the pain. That means the chi is deficiency in the pulmonary system. So now you look at about the anything is connected to the lungs problem, maybe acute or chronic or some other known and unknown case of the dry artery, the middle cerebral artery, all are communicating to the brain through with the support of that. That's the reason this always is good to apply this point. Also useful to treat for the mind constitution, even for the female, especially the menstruation related disorders. There is the delayed menstruation. You wanted to give the command to the UB14, that also really good. I remember 2 points for the female to female, you just apply one to be known as a UB14, the second point to be known as a Boulang. Bulang is the kidney 22 point. Both the points are good point to treat for the, no doubt the Bulang point is located on the tooth chun lateral to the fifth intercostal space. The point is located on the chest region because chest also responsible to regulate that, because the what we call as a, there is a lactic acid or the breast which called as a lipase. What kind of the hormone? There is a prolactin. Prolactin is important to treat for regulate for the menstruation as well, but therefore you are treating to the prolactin to regulate the menstruation flow as well. Then UB14 is a good point. Here I have given the two combination. You wanted to treat front and back, then you just add up the point is the front 1 point and also back 1 point to target the front side of the body. That's called as the in and then yang. Yang to be known as a UB14 and then in to be known as a REN 17. The ventral side of the body to be known as a Zhang. The dorsum region to be known as a Fu. Right, Zhang Fu theory based on that principle. Then UB15, I love this point to treat for the numerous diseases where exactly fifth vertebra this point is located. The point to be known as a Sin. Sin means is the heart. Shu means is the point. Sin is the heart Shu point. Where the exactly located? Here you recognize the two things. One to be known as a fifth thoracic vertebra, the point is located. The front side to be known as a, there is the fifth intercostal rib treatable for because heart is divided into four chambers. Four chambers are the four places. One to be known as a SA node, the second to be known as a AV node, third to be known as a bundle of his, fourth to be known as a Purkinje fibers. But where the Purkinje fibers are there, the Purkinje fibers area to be known as a fifth intercostal space. Then you just target on the first region also. You can target on the front and back together to treat for the cardiac related disorders. No doubt even I'm treating the number of the cases for the heart related problem. The people after the angiogram, nearly 60% blockage, 70% blockage, even 80% blockage. I don't wanted to take the risk, but still the people are coming forward to take up the acupuncture treatment. I'm treating since they are coming forward. They don't want to go for the surgery. But I recommend the first line of the treatment. Please go and do the angioplasty or some kind of the modalities. You just take it based on the cardiologist. But however, they have taken some kind of the medicine. Along with that, they wanted to continue our medicine or our treatment. Definitely, this will be the added advantage. Even we don't prescribe any medicine. So along with that, we can continue this point also. Really, today is not good, but down the line, definitely have the positive results to them. Now, two ways you need to target. एक सामने से target करो, दूसरा पीछे से भी target करो. तो जब ventral side of the body having giving the signal to the heart, then also ventral side of the body also giving the signal to the cardiac system. दोनों तरफ से. So bilaterally we are just activating. Obviously one person is not awakening from the front side or the back door, the person is activating. Definitely we are going to awaken that particular organ in order to nourish to that particular organ as well. So hopefully you understand, because I'm giving you two protocol, one to be known as a ventral side and then also dorsal side. And the people very new to them where the REN 14 may not understand, but hopefully when we take up the REN meridian, that time you come to know. Then UB16, that's called as a Du Shu. Du Shu is indicating there is the point which we call as a back shu point for the diaphragm. Diaphragm, above the diaphragm is different, below the diaphragm. What does it mean, diaphragm? Diaphragm is the place where there is a bifurcation for the two cavities. One to be known as a pectoral cavity, the second cavity to be known as the middle cavity, isn't it? So above the chest to be known as where exactly that's nipple is located. So above nipple to be known as a thoracic cavity or the thorax, but below the nipple, below the breast region, that to be known as a abdominal cavity or the middle cavity. That is the base. So that related problem, people due to that reason, there is a cardiac or the respiratory muscles get problem. Even for that condition also we can use it. But however, this also point for the treatable for the pruritus. Pruritus is indicating any kind of the skin related disorders, any kind of the eczema or the psoriasis related disorders also can address by using this one particular point. Then the 17th point is the great point. I love this point too much, but however day-to-day clinical practice is my choice of the treatment to the most of the conditions. You can use as a K, Shu. K is indicating blood. K means the numerous meanings are there, but however here consider as a K, Shu, G, E. Pronunciation is the K, K, Shu point is indicating to treat for the, where this point is located, UB17? Yes, T7 vertebra, the point is located to treat for the, especially for the The Shui means is the blood related disorders. Any kind of the blood disease or blood disorders, there is a anemia condition, or maybe any kind of the blood pathology is there, even for that condition. You look at about the people who are suffering low immunity, lymphatic system is not good, drainage system is not functioning in the body. That time what we should do? We just activate to the blood. Blood is deficiency also reason to cause the problem. The blood excess also reason to cause the numerous problems. Excess is indicating. You look at about the white blood corpuscles. What is the normal range? What is the normal? Very good. 4 to 11,000 is the normal. If goes less than 4,000, your immunity is very poor. Where is the white blood cells? It goes greater than 11,000. There is a seriously some kind of the inflammation or the infection in the body. But it goes 50,000, 1 lakh. Then there is the malignant as well. There is the cancer as well. So therefore, we should be very careful where the synthesis of the blood cells to be optimistic level. Hyper, both it causes the problem. That's the reason gay shoe point is important to regulate the blood toxicity or the blood related disorders. The people who are learning or the people who wanted to do cupping therapy, please you just add up. No doubt there are the 9 sunnah points are existing in the body. One to be known as a yafuq, and then second is the al khamadwa, and also kahil al qatifain, and then waraq points are existing, and al khadami as well. But along with that, you wanted to add up, remember this one particular point for all the blood related disorders, because blood is good, blood is purified. Then you just add up the point. This is my choice to apply to all. Whenever I do the cupping therapy, no doubt the first choice to be known as a kahil awwal is indicating is the all the diseases. You just add up the one single point to be known as a DU14, where exactly on the CT junction, cervical and then thoracic junction. But along with that, please you just add up the point to be known as a, that is the K shoe, that is the important to be known as a this UB17 point. So don't forget to apply. When the blood toxicity comes out, the blood is purified, then obviously hundreds of the diseases can be treatable by activating the single point. Why? Because the blood toxicity is there, or the blood is not synthesized in the body appropriately. The problem here I wanted to add up, I love this combination, that to be known as a Swanchung, that is called as a GB39. Together, it treats for the stem cells, it treats for the raw cells, it synthesizes to the red blood corpuscles, it treats for the white blood corpuscles. That's called as a red bone marrow, yellow bone marrow. कौन गुद खाते हैं ना उनको अच्छी तरह से पता है कि yellow bone marrow, red bone marrow, all those things will synthesize the blood through that. So therefore that's very crucial. So then you just activate this both point. Bilaterally you just apply 4 points, 2 plus 2 points, that will be really helpful to treat for the numerous diseases which is connected to the blood synthesis. Even blood produces here naturally, or the blood toxicity also comes out when you do the wet cupping therapy. When you do the wet cupping, try to recognize what is the brownish red color is coming, that indicating is the very toxic blood, and then is the reddish blood is coming, that indicating is the purified blood. You try to analyze and recognize what kind of the blood is there. Then also there is the thickness of the blood is there, that indicating yes, that is also not good, because there is the insufficient of the water the person is taking, where the hydration is not good in the body. Then come to the UB18, this called as a gun. You remember as a gun. So which gun is there in our body? Very good. Gun shoe to be known as a liver point. That means that it looks like a gun. Similarly, you can remember pronunciation to be known as a K-A-N. Kan means is the liver according to the Chinese. That's the reason they mention as a kan shu. When you write down gun shu, but when you pronounce as a kan shu, that is anything you can pronounce. This to be known as a UB18, where the point is located. Very, very good. One vertebra got missed here. This is the one secret, you keep it in the mind. All the vertebrae we do have the point, but UB meridian, one vertebra is missing. That vertebra to be known as a T8 vertebra is missing here. Thoracic 8 vertebra is missing, but no doubt thoracic 8 vertebra. There is a very big particular point is there. That's called as a Wei Quan Xia Shu. Wei Quan Xia Shu is indicating that is the insulin point is located on the 8th thoracic vertebra. But don't worry, when you apply, even for the diabetes patient, you wanted to apply the point, insulin point, please you just apply on the right side rather than applying on the left side, because that is a splanchnic nerve which passes from the spinal cord to the spleen and then pancreas. It reaches the nerve. That's the reason better you apply to the right side, that goes to the pancreas. Left side of the UB18, UB17.5, that point goes to the spleen on the right side. spleen on the left side, pancreas on the right side, that now passes to the pancreas. So therefore UB18 is good point to treat for the liver related disorders. But just on the this point is 9th thoracic vertebra, this point is located, therefore that point is move back shoe, that means the back shoe point for the liver hepatic organ. Then you just add up the point is the front point as well. You wanted to treat for the liver related disorders. Liver is the chemical factory in the body. Liver having the pathology. Remember, 100 of the diseases can be treated, causes in the body. If the liver is good, hundreds of the diseases can be treatable, or the problem can be solved by activating. That's the reason I have done the one video. That video to be known as Yata Tun, that is the liver 1 point to treat for the 100 different types of the disorders. So why is it so? Because so important this particular point. UB18 point is great point to treat for. Together you just add up. Always you remember for the diabetes patients and also GIT related disorders, even obesity conditions, you just even kidney function, the malfunction of the kidneys, you just add up these 2 points, always is good. UB18 and then liver 14, that's called as a chi men. Chi means is the vital energy. Men means is the gate. Energy gate is existing in the liver. That point is located on the 6th intercostal post, just exactly below this nipple. The point is located. That point to be known as a liver 14. Right. Then UB19, the point to be known as a dancing. There is some dancing to be known as a gallbladder dances. And similarly, you can think that the UB19 point is tan shu. Tan means T-A-N, tan pronunciation, but when you wanted to write D-A-N, dan, to be known as a gallbladder, shu means is the point. So UB19 point is located. Where is it located? UB19 on the 10th thoracic vertebra. You add up 1 point extra here, right? UB18. So UB17 on 7th thoracic vertebra. UB18 on ninth thoracic. You add 1, that is the 9th thoracic vertebra. This point is located, and then UB19, the 10th thoracic vertebra. This point is located. This point to treat for the all the cololithiasis. Cololithiasis is indicating is the gallstones. Cholecystectomy done even for that condition also, or any inflammation or infection in the gallbladder, even that condition also we can treatable by activating the UB19 point. Along with that, which is the point is the move front point. Rio. Yeah, Rio is GB24 point, where on the 7th intercostal space, the point is located, that is UB19. So don't worry, just you are listening in the Zoom as well, and also listening in the physical class. You all come to know where appropriately is located. We'll try to show you where exactly the points are located. So then further UB19 is the good point to treat for the what condition? Gallbladder related. Then P shoe. P means P means is the spleen according to the TCM. Then the P shoe point, but this point is treatable. Where to apply this point? The P shoe. Yes, the right side you just apply for the pancreas, and then the left side you just apply to the spleen. Now there is a back shoe point for the pancreas. If we ask you one question during the examination, write down the back shoe point for the pancreas. Then what you will going to write? UB20 right side back shoe point to be known as the pancreas. Same UB20 on the left side back shoe point to be known as a spleen. So in the this is a little variations are there, but try to recognize this also will be helpful. What condition? All the spleen transportation and transformation. The spleen is the major role. Is the lymphatic system or the drainage system, or there is anywhere in the body there is a distension. The swelling is there. Even for that condition, the dampness is there. Muscle related disorders, muscular related disorders. Even for that conditions, you can add up this point is good. Then move front alarm point, which is a point that is called as a Chang Men. Chang Men is the liver 13 point. Liver 13 point also when you wanted to use the point, but this is liver 13 where the Ulakaranan process of the ulna, it touches this to be known as a where the exactly in front of the 11th rib. When you touches it connects to the 11th rib. Then you go back, that's called as a 12th rib. But however you place like this, where this touches, that is the liver 13. That also good point to treat for the spleen and then pancreas. So where exactly the muscles called as the latissimus dorsi muscles, those muscles, then 11th and 12th thoracic nerves, there goes to the that particular region. Remember the one more secret I would like to give you. Are you ready to obtain? Ready to get in? ಇಫ್ ಯು ನಾನು ಊರ್ಜಾ ಎಷ್ಟಾಯ್ತಾ ನೀನು ಊರ್ಜಾ ಏನಾಯ್ತು ನಿಮ್ಗೆಲ್ಲ ಮಾತಾಡಿ ಜೋರಾಗಿ. ಯಾವಾಗ ನಾವು ಒಂದ್ಸಲ ಆಪರ್ಚುನಿಟಿ ಕಿರ್ಚಬೇಕು, ನಾನು ಕಿರಿಸ್ತಾ ಇರ್ತೀನಿ, ನೀವು ಕಿರಿಸ್ದೆ, ಓ ಅಲರ್ಟ್ ಇದ್ದಾರಪ್ಪ ಅನ್ನೋದು ಭಾವನೆ ಬರುತ್ತೆ ನನಗೆ, ನಾನು ಮತ್ತೆ ಕಿರ್ಚಬೇಕು ಅನ್ಸುತ್ತೆ. ನೀವು ಜೋರಾಗಿ ಹೇಳಬೇಕು. ಶಾಲ್ ಐ ಟೆಲ್ ಯು ಒನ್ ಸೀಕ್ರೆಟ್?
Yes, sir.
Zoom.
Yes, sir.
Only one.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
That urja need to come from your inner heart. So you just listening, I know you are seriously listening to me, but still whenever situation comes, you just open. But what kind of the secret I wanted to tell you? In fact, it's out of my mind.
Yeah.
What I'm thinking here. You be 20 and then liver 30. Yes. No, nothing pancreas here. But vertebra which passing to there is the 10th thoracic vertebra. Remember, the 10th thoracic vertebra, if there is a problem in the navel is the nerve which passing to the umbilicus. The people today, we have the umbilical hernia or maybe some kind of the problem in the navel, because navel is the central origin, central energy point, so which nourishes to the entire body in the mother's womb for the fetus, isn't it? So therefore, that any kind of the navel recognition you wanted to recognize, then you recognize on the back region, that to be known as a T10. As I told you, there is the splanchnic nerve which passes to the spleen and pancreas, right and left side. In the similarly, you recognize if there is the navel having the problem, then you keep it in the mind. Yes, I need to treat for the thoracic 10 vertebra. Thoracic 10 vertebra, it passes to the umbilicus region. Above that region having the problem, you focus to other vertebrae. Below the navel, you wanted to treat, then you treat for the T11 and then T12 as well. Right, UB10, UB20 over UB21, backshew point of the stomach. So this is most of the times you remember spleen UB20 and then UB21 and then UB22. Remember Chu in Sanjio Shu. UB22 is the Sanjio Shu. These are the 3 points majorly you can recognize. Even you can recognize from the liver. UB18, UB19, UB20, UB21, UB22. Please keep it in the mind. The entire alimentary system is here. Entire alimentary system is here. Remember, from the mouth to anal region you wanted to treat, then you just focus only the how many points? 5 points. 5 areas on the right side and left side. Please address to the all the digestive related disorder in terms of everything. Gastroenterology department is here, but however we respect to them, they treat the numerous diseases. But however here also, even you wanted to add up the another point to be known as a Ta Changshu, Xia Changshu, that is called as a large intestine, and the small intestine is not there here, but we can cover even that also. Then I am sure you that the entire enterology department or the gastroenterology is related to the gut, gastro is related to the stomach, then alimentary system from the mouth to anus, hopefully we can regulate by activating the point. Remember, is the 7 points. What are those? Please come on, guys. UB 18, 19, 20, 21, 22, 25, 27. These are the points. Only this much points is going to help to treat for the many diseases related to the digestive related disorder. That's the reason you wanted to know shortcut. Then definitely I'll try to give you a tool that through that tool you wanted to activate. That also most probably will going to helpful to treat for the many diseases. Hopefully we'll try to see roller. If the backshew roller is there, through that roller you wanted to activate all the points, because you can give with the thumb pressure, or you that will be painful later period. That's the reason you just use the spinal cord roller. Most probably I'll ask somebody to bring here, but that also during the practical session we'll try to see that how that roller to be activated to this entire region. Then further you can see there is a UB22. I love this point too much, because I think Tatiana, are you available? Where is Tatiana? So I think here I would like to say this is the adrenal gland point. This point is related to the adrenal gland, backshew point for the adrenal gland. Triple warmer also to be known as a here. There is a suprarenal gland, that to be known as a adrenal gland. So that gland can be treatable by activating the point to be known as a. There are the 2 points you can remember. One to be known as a that Sanjio Shu. The second point to be known as a Shemen. Shemen is the Ren 5 point. Right, both the points you just activate, this will be helpful. But however you wanted to activate another point to be known as a, which is the endocrine meridian, triple warmer meridian. That meridian also is going to help to treat for the endocrine system. right? Then Quan Chung, that is the San, this called as a Quan Chung, that is the Sanjo one, also will going to help for the gonads as well, and also reproductive system. Then further we're going to see 23, that's called as a Shen. Shen means the spirit. Again, Shen means the kidneys as well. The kidney shoe point to be known as a UB23. No, before that, where is UB22 point is located? Yeah, UB21, the point is located on the 12th thoracic vertebra. UB21 located on the 12th thoracic vertebra, but whereas in UB22 is located on the first lumbar vertebra. 1.5 chun, same line we do have the points. 1.5 chun lateral, UB22. When you remember, whenever the people who are taking the corticosteroids medicine, like a prednisolone, cortisone, and also betamethasone, beclomethasone tablets, who takes the steroids medicine, even that particular time UB22 will going to work for the steroids. So therefore, this will be indirectly helpful to treat for the what condition? Synthesis of the steroids as well, cortisone level to be regulated, adrenal gland to be regulated by activating this point. So hopefully this also will be helpful for the triple warmer mechanism as well. Now UB23 is the Shenshu. This for all the renal related disorders or the kidney related disorders. Where the point is located? UB22, the point is located on the second lumbar vertebra. This point is located. But however, the patient is complaining, I do have the back pain. The back pain is indicating the kidney deficiency. Also reason to cause the most of the back pain according to the TCM. Then don't say that the back pain do you have. Then do you have the kidney problem? So you don't directly talk to them. You just say maybe you can recognize this region you have the weakness. Convey the message. Even I do like this. That perhaps I recognize there is a kidney Ks deficiency. Then I put a word, the belt meridian. The belt channel you have the deficiency. It's indicating is the lower abdomen. It's indicating to the abdominal region. It's indicating to the entire back region. So kidneys are located here. The kidneys are located on the posterior, where the 12th rib is there. 12th rib, posterior to the 12th rib, the kidneys are existing. So therefore, when we can consider that this entire region has the deficiency, then they say, yes, I do have the pain on my back region. They easily recognize. So in that way, if they are today, most of the people knows where the kidneys are located. Non-medical doctors also, the layman also recognize. Even they study 10th standard, they study the 12th and PUC. Even they can easily recognize where the organs are located. So therefore, UB23 point is the back shoe alarm point for the kidneys. So therefore, you can add up this point to treat for the back pain. This will be really helpful. This is the second lumbar artery, and then vein will going to supply to that particular region as well. There are the lumbar nerves also passing to that region. Then the 24th point, the name is Kachi. Chi, Hai Shu. Chi. Chi means the energy. Hai means the Chi is the meeting point of the Chi meeting point to be known as a Shu point. That's called as a Chi Hai Shu. But there is no specific alarm point, this point. But however, this also helpful to treat for the, even you can recognize the point to be known as a Zishi. Zishi, and then is the Pao Wang. That points according to the Hidama, we can recognize that's called as a Varach. Varach points are located bilaterally, and he said this the point is really crucial to treat for the many diseases of the lower back region. Then further, the Ta Changshu, where the point is located, this point. UB25, the point is located on the fourth lumbar vertebra. The point is located on the fourth lumbar vertebra. But how to recognize this? That also I'll try to show you. Different lines are there on the back points. How to combine the points. Which line is very important. From one line to another line, how many vertebrae are existing? That we're going to recognize through the practical. But now you can see UB25, the point to be known as a UB25, the point to be known as a Ta. Ta means is the big. Chang means is the intestine. Shu means is the point. Ta Chang Shu, the big colon back shoe point to be known as a UB25, located on the 1.5 chun lateral to the lower border of the spinous process of the fourth lumbar vertebra. This point is located. So therefore, this point will be helpful to treat for all the colon related disorders, large colon related disorders. The small colon is different, but large colon, this can be addressed. But however, this indirectly will be helpful for the small intestine as well. Now this point to be known as a Kuan Yuan Shu. Kuan means the original. Kuan, Yuan also source. Gate. Kuan is the passage. or the original acupuncture point on the back region. The point is located 1.5 chun lateral to the where exactly on the fifth lumbar vertebra this point is located. That's called as a UB26 point. That's called as a Kuan Yuan Shu is the most profound important point. Then there is nothing significant on that region, no alarm point over that. But now UB27 Xia Chung Shu. Xia means small, Chung means the intestine, Shu is the point. So small intestine, back Shu, small intestine alarm point. Any problem in the small intestine or the large intestine, you can add up this point for the transportation of the unwanted morbid accumulation in the colon. That is the retention is there. I think yesterday or day before yesterday, one patient told me that, so when did you pass your stool? But he told me that, so 4 days over, I passed my stool. But that means you remember there is a retention. He is eating all the 2 to 3 times in a day. Happily he is eating the food. But despite of that, where is it going? Is the entire gut metabolism and also accumulated. Somewhere the absorption is not good. That got the retention in the colon. How many feet of the colon? Small intestine, how many feet? Large intestine? Good. 5 feet long to be known as the large intestine, the small intestine around 17 feet to the 22 feet long to be known as the small intestine. But somewhere got retention. The person also obeys. Even for the lean patient also they do have the constipation that is indicating 4 to 5 days he go passes. Even some patients it goes 7 days once. That is really pathetic situation. But they are the habitual that yes, I'm okay. I want, by looking the biryani, I wanted to eat. By looking the bakery, I wanted to eat. Despite of that, it's not passing out, but input is going on, but unloading is not happening. But still he's eating the food. So one day we're going to blast totally. But it's not good, by the way. Remember every day, once in a day, or twice in a day, or thrice in a day, you are passing the stool. That's not a harm. That's not a disease. So need not to worry. But now next point to be known as a UB28. The point to be known as a bacterial alarm point for the urinary bladder. That's called as a UB28. That's called as a Peng Kuang. Peng Kuang. Peng Kuang means the bladder in the Chinese medicine. Shu. Peng Kuang Shu. So this is the UB28 where the point is located. 1.5 chun lateral to the second posterior sacral foramen. This point is located. So hopefully this is the how to locate. There are the 2 dimples are there. So how many of them? Dimples are there on the face, dimples are there in the knee, dimples are there on the back region, right? Even we wanted to create the dimples, we can create the dimples on the, the shoulder also we have the 2 dimples. Likewise, so we do have the dimples on the back region. From there, we can recognize these points as
Rupees
well. Where the points are from
700
1, 2, 3
received
is
on
existing.
PhonePe.
So let me see. So this particular point is located on the second posterior sacral foramen. This point is located. So where exactly the point is located in the foramen? Where exactly? Do you know? Which point I was talking? Pangkuangshu. UB28. But you remember there is a hollow. Which is the holy bone? Sacrum bone. In that sacrum bone, how many holes are there? 4 plus 4, 8 holes are there. But bilaterally, the second hole, in the second hole, you just apply inside the hole. Even the Chinese people taught me, you just apply the 2-chun needle deep to that hole that reach into the urinary bladder. So that goes deeply to that region, right? So in that way, that will be really helpful to treat for the pudendal nerves. The pudendal nerves, vesical nerves, cavernous nerves, and also there is certain nerves which passes to the pelvic region that goes to the pudendal nerves is passing to the glans penis, and then cavernous nerves which is passing to the penile organ for the erection. So therefore any problem for the male and then female having the problem, that time this will going to help to the patient in order to rectify the problem of the pelvic region. How today I think you are selling the Viagra tablets too much, but even that kind of the problem we just address by activating this foramina deeply, so that will going to help the patient to rectify, because again it is the male and female both are very important. The male to be known as the glans penis, pudendal nerves. Then there is the cavernous nerves which is passing to the penile organ. Where is the pudendal nerves that passing to the clitoris? Then the clitoris erection that to be taken place with there is the dorsal nerve which is passing through this will going to help to the female as well. So hopefully, because frigidity and then impotency. Frigidity for the female is the less sexual desire, and then is the more sexual desire to the male or less, so that all are connected to this region as well. But however indirectly will going to help. But along with that, you wanted to add a point to be known as a chung chi, that is called as a Ren 3 point as well. Together you just add up this point, will be helpful to treat for the urinary bladder related disorders. Now the point to be known as a UB29 Chung Lo Sho. So this point is located on the third posterior sacral foramen. This also treat for the hernia. Hernia again, it is indirectly will going to helpful, but not directly. That to be known as inguinal hernia, but not the other part of the hernia. There is the umbilical hernia is treatable on the thoracic 10 level, whereas in the inguinal hernia is a treatable from the that's called as a third posterior sacral foramen. Third posterior sacral foramen. Then the UB30 point known as a Pao Huang Shu, where exactly the point is located. 1.5 chun lateral to the at the level of the fourth sacral foramen. This point is located. That point to be known as a Pao Huang Shu. So now the another meridian we completed partially. That is the second ramification from where we started our journey. Second ramification UB 11. From the UB 11 to from UB 11 to UB 30 we completed. UB 11 to UB 30 we completed. That to be known as a that to be one particular line. That line to be known as a medial line of the UB meridian. Now coming to the downwards direction, there is another 4 points are there. I love this point too much. But however, day-to-day clinical practice, we just use the point to be known as a Pa Leo. Pa means is the 8. Leo points are existing. Shanglio, Silio, Chunglio, Sialio. This side is 4, this side is 4. The Chinese told me that, Baba, don't say Shanglio, Silio, say Palio. Palio is the 8 points. So remember, if I recognize certain things, then easily I captured all those what they says. But otherwise, it's very difficult for me to recognize the things. But now I'm giving you entire information to you. So you just add up that's called as a, you just even some of the textbook, you just use the points called as a paleo. But there is no acupuncture single point in the name of paleo. Then you recognize that the pa is the 8, Leo points are these 4 plus 4, 8 points are existing bilaterally. So therefore, where the points are located? So these points are located here is the paleo, where exactly 0.5 chun lateral to the spine. That's called as a Huato Chiachi point as well. Chachi ko yaad rakhna. So that indicating there is a 0.5 chun. Lateral to this spine, we do have the point called as a Shanglio. That is on the first sacral foramen, which we call as a UB 11, 31, UB 32, UB 33, UB 34. So these points are located on the sacrum region, sacrum 1, 2, 3, 4. What was previously we are talking? On the foramina, on the whole, the points are located. But here is located is in the 0.5 chun lateral to the spine. We do have the points. This treat for the S1, S2, S3, S4. Remember the spinal nerves you wanted to treat. Remember this called as a spinal nerves. This called as a spinal nerves. This called as a spinal nerves. Spinal nerves are treatable for what condition? For the urinary bladder, and also there is all the entire urinary bladder is indicating to the fallopian tubes and ovaries and uterus related problem. Definitely you can address this point, also will be helpful. Even for the delayed menstruation, remember moxibustion of the dedo. Is it completed moxibustion class this academic year? Not yet started, isn't it? So
No.
moxibustion also really helpful to treat on the, even I would like to say even the evening or in the daytime, maybe the majority of the people wanted to convey the message to me that yes, what class I wanted to address for the next week. Any specifically you wanted to know, then how I selected as a epilepsy. But this evening, but that's a very crucial, it's a great subject, but I would like to address in the evening. But likewise, you have anything in the Kerala, நீங்கள் எந்தெங்கிலும் சோதிக்கணும் எனக்கு இல்ல சம்சாரிக்கணும் இல்ல ஒரு பர்టిక్యులர் டாபிக்ல உங்களுக்கு நான் பறையணும். சோ நீங்கள் பறையும் அதை நோக்கிட்டு நான் நெக்ஸ்ட் கிளாஸ்ல அதை அறியாம். ஓகே, I'll do that, whichever it is, even your choice will be really good, I feel. Yes, good. That also will look into that. Definitely, I have the desire to do that. But even clinical methods of the practice, that's really important. That also will going to address. Pulse diagnosis is the later period. Later period. Without pulse diagnosis, the class will not going to end up. No means end of the year. Then what is your opinions in the Zoom? What is I think Jayashri is asking me to take the pulse class, pulse diagnosis on the coming week itself, or how we I love to do anytime.
Sir, very important, sir. Pulse diagnosis. We
I
need
think
it, sir.
if everybody is agree, but coming week itself is the pulse diagnosis. Hopefully,
Oh,
I love too much to make you to understand that is also really crucial because that's very important to recognize the diseases or disorders. So hopefully coming week is fixed. That is the morning will be the pulse diagnosis class. All of you please do participate. Physical class, you people are coming post 11 o'clock. Even I don't feel really good. Be there at 10:30. I'm also here. Then we will start at 10:30. Most of the coming class will be the pulse diagnosis. Dr. Geeta is telling me to take the what is pulse diagnosis and something else also she has tongue diagnosis. So maybe the pulse diagnosis I will do that and later
The
tongue diagnosis.
moxibustion.
Oh, moxibustion. Yeah, moxibustion also I'll take very soon. And I think we'll consider that. What is the date today? Today is 9th. So this week I'll take up you. This week coming week I'll take up you the pulse diagnosis. Next week I'll take up the moxibustion. I think that also it is the part of the treatment. Most probably I'll do that. And later period the tongue diagnosis also because the people are studying the points and points and points are so too much points is taking to the mind. But sometimes we change the pattern. Coming week is the pulse diagnosis. Today is 9th, no? 16th is the pulse diagnosis. 23rd will be the moxibustion. Dr. Geeta told me I'll take up that also. No, that cannot be possibilities are there. I'll do it systematically because all the people should be benefited. That's what I mean to say. Right, where I am, this called as a Cialio, that is UB 34. So 3 points, 4 points are one line you have completed. This called as a Shanglio, Cilio, Balio. Remember, there is a 31, 32, 33, 34. There are the 4 points here, 4 points here we completed. Now we are going to see that is the coccyx. The people says I do have the coccyx bone pain. So that time you one point you remember that point to be known as a Hui Yang. Hui Yang. Yang is connectivity point. Hui means is the meeting, Yang meeting connectivity point. That's called as a UB 35 point, 0.5 tune lateral to the tip of the coccyx. The tip of the coccyx is like a curve. Coccyx is like a curve. That curve need to be, the curve need to be lifted that. So even that condition treatable by activating the UB 35 point is really good point. So for the coccyx pain. Then now the coming points are really important points. Then further I'll move on to the, I'll give the very short break for 2 to 3 minutes. Then I will proceed, but not now. Till I complete 40 points, please be there. The 41st point, then I'll give the break before that. So 36 point is the Cheng Fu. So this point where exactly is located? There is the glutes, which is the biggest muscle in the body. Glutes, which is the smallest muscle in the body. Spadius muscles, which is located inside the ear. 1 mm muscle. Remember, I really say, but how this is so important. Nearly 642 muscles are existing in the body. Among them, biggest muscle to be known as a glutes muscle. The smallest muscle to be known as a ear. That muscles to be known as a 1 mm. Remember, not 1 centimeter. 1 mm muscle also there is named it. That's called as the stapedius muscles, which is the smallest bone in the body.
Stapes.
Miss, you remember, Miss. Malleus incus Stapes.
Stapes.
Stapes muscles is the smallest muscle. Spadius smallest bone, but spadius muscles also smallest bone in the body. How many millimeter? 1 millimeter. 1 millimeter means how much? Itna sa. Very small, tiny muscles to be known as a spadius muscles, which is located inside the ear. That is the smallest muscle. Glutes muscles to be known as a biggest muscle. But if these muscles below that muscle having the problem, that's called as a the hamstring muscles. Hamstring muscles is the group of the muscles, but our 3 muscles collectively to be known as a one name, that's called as a hamstring. That particular region, most of the times the patient are suffering. I do have the pain on this region. That time on the back of the muscles, back of the thigh, having the problem, that indicating there is, you just add up the point called as a Cheng Fu, that is UB 60, 36 is the good point. Then the UB 37 called as a in men. This also one of the gate. So where exactly 6 tune below from the UB 36 the point is located. This also good for the hamstring muscle motor point. Then UB 38 is the Fu C. This is the really, I love this point. I'll show you practically how so crucial to treat for the posterior side of the knee pain. People most of the times knee pain are the anterior knee pain, medial knee pain, lateral knee pain, posterior knee pain. If the patient is suffering for the posterior back of the popliteal fossa, you touch the popliteal fossa back of the knee, there the patient feel there is some kind of the cyst called as a popliteal cyst here. The patient feel there is a cyst here is indicating popliteal cyst. Even that condition, how to insert the needle, that I am going to show you. That's called as a Fu C. Then next point to be known as a Veiyang, that is the UB39, where exactly the point is located. One shown lateral to the UB40, the point is located, but this also lower HC point for the triple warmer. This is the lower HC point for the UB39. This is a day-to-day clinical practice. I uses these 3 points. That's Fusi, Wei Yang, Wei Chung. These are the 3 points for the day-to-day. Every day I used to apply the needles to the people who are really suffering for the knee pain, especially the posterior knee pain. Then you apply the Wei Chung. And most of the times there does a mistake where the point is located. So this is a UB40. You remember there are the 2 tendons. One to be known as a femoris tendon, bicep femoris tendon. The second tendon to be known as a, remember my name, semitendinosus tendon. So in 2 tendons center, the point to be known as a Wei Chung. Wei means is the defensive mechanism. Chung means is the center. The back defensive mechanism are supporting to the back to be known as a Wei Chung. That is the UB40 point to treat for the most of the related disorders of the knee region. I think now I just wind up. You just give a round of the applause yourself and